Welcome to the Fac Dev Lounge podcast, your DMNB podcast for faculty development. I'm Sarah Gander, your host, and today I get to welcome Dr. Brent Young, who's assistant professor at Dalhousie and the new academic director of Indigenous Health. This is podcast number 20, and so I'm so pleased to have Brent with us today, talking about why faculty should bring Indigenous cultural safety to medical education. Hello there, this is Sarah Gander, and I'm your host of the Fac Dev Lounge podcast for DMNB, but Dalhousie University as a whole. Today, I'm so glad to welcome Dr. Brent Young, who is joining us from Halifax. And Brent is the academic director of Indigenous Health and an assistant professor at Dalhousie and a family physician. And so I'm so happy to welcome him today to talk a little bit more about some of the new role that he has and Indigenous issues for us as a faculty in Dalhousie University. So welcome, Brent.
Hi, Sarah. Thanks for having me.
Thanks so much for joining us today. I know that there's lots to talk about, but I'm so excited to talk about your new role and kind of introduce you a bit to the faculty here at Dalhousie. I know they're always excited to kind of hear about the new roles that people have, and it's super fun to be able to meet some of the other folks that we may not otherwise cross paths with. So tell us about yourself.
Yeah, so I'm Anishinaabe. I was born and raised in Unama'ki, or Cape Breton, Nova Scotia, as a result of my mom being displaced from her home community in Sandy Bay, Manitoba. So I've spent my whole life out here, with the exception of the last 2 years when I was doing my family medicine residency at the University of Calgary. And so I returned this past summer to take the role of academic director of Indigenous Health in the Faculty of Medicine, as well as my role as a family physician in Sebag-Negedy and at the North End Clinic in Halifax.
Yeah, so just a few busy things to keep you occupied.
A few small things going on these days.
So when did you take on this new role at Dalhousie for the academic director?
So I started in early July, pretty much as soon as I returned from Calgary. And so the last several months, we've kind of been working on kind of strategic direction for the position and kind of really trying to delineate what exactly it is that I should be focusing on in the early days, and then kind of moving forward from there, helping the Indigenous Health and Medicine program in the Faculty of Medicine kind of develop a good program and direction moving forward.
So wait, I don't think I appreciated when I talked to you before. You just finished your residency and then you came back, and not only did you start your practice and start working, you assumed this faculty position as well?
Yep. Yeah. So I graduated in June for my residency, and then the faculty position started in July. And then I gave myself a month before I moved into practice, because there's a few moving parts that have to come into play for that.
Did nobody give you the advice that you're supposed to say no to everything for the first year so you can get your feet under you?
That's actually funny, because I was actively pursuing all this, and everybody's like, I'm just going to locum and have a good first year practice.
Oh my gosh. Well, so you've hit the ground running. You have this wonderful position that's so needed and overdue, but also has a kind of tall order ahead of it. So what do you think is sort of your first thing that you might want to tackle?
I think the biggest priority for me in recognizing the huge lack of resources that we have in this area is to actually work on the admissions process. So we've kind of hit the ground running in that regard, and we're hoping to do some work around improving the process for admissions, particularly for Indigenous applicants, with a focus on Mi'kmaq and Wolastoqey people, as well as Passamaquoddy, because those are the communities that we serve as the Faculty of Medicine in the Maritime. So been doing quite a bit of work around that now, and trying to bring the right parties to the table to look at what those processes and policies may look like moving forward. But then, of course, there are the other pieces, like the educational pieces, so providing some teaching to faculty, staff, as well as students and residents in the early days. But those are the kind of areas that we've been focusing on in recent months, and the demand is huge. I get asked to do a lot of things at a lot of different tables, but it's trying to figure out what priorities we need to focus on in the early days, and then kind of build out from there.
Oh my gosh. Well, hopefully this podcast will serve as a bit of a venue to deliver your message even more broadly outside of Nova Scotia and into New Brunswick. So, you have friends and allies across the provincial border to do your good work. Do you feel with the admissions process, there's like any super low hanging fruit? Like, you went to Dalhousie, so you were admitted to Dalhousie. So is there something that you think that like could just be changed with the process that's super easy? Or does it all feel like kind of an uphill, challenging task?
I think with recent events and with the current direction of the Faculty of Medicine, I think there's been a lot of momentum in this area. And it's kind of surprised me, to be honest. If you had asked me this question like 5 or 6 years ago when I first started out on this journey, I probably would have said like, this is a huge uphill battle. But since coming into this role, I think there have been quite a few barriers that have been lifted. And so I think right now we're at a point where we may not know exactly where this is going to take us or what those changes will look like, but we're at least bringing the right parties to the table to make some of those decisions and have some of those discussions. And there's actually like a willingness in the Faculty of Medicine to accept some of these changes. And the biggest thing will actually be to not repeat the same mistakes of the past, where we have just a few select members of the community sitting on various organizations or committees in the Faculty of Medicine, but instead actually moving to a system of governance and oversight that is actually centered in the community and actually in the hands of the community. So I think that's where we'll see some success in that initiative, and I'm quite excited to actually move forward on that.
Yeah, no doubt. My goodness. So, I mean, recent events being, of course, just the increased kind of understanding and knowledge and like mainstream conversation about things that have been known for a long time. Like, I mean, I'm a pediatrician. I think a lot about the residential school situation. And then also with our recent September 30th being a day of recognition for that and for truth and reconciliation. How did you feel about the September 30th day? If that's okay to ask, do you think it did what it was supposed to do in some ways, or do you feel like it was not on the mark?
I think the answer to that question might be a little bit different depending on your province of residence, and knowing that places like New Brunswick chose not to recognize the day as a holiday, or a day of, I guess it was still a day of commemoration in New Brunswick, from my understanding, but it wasn't actually like a statutory holiday. So I think there's some mixed feelings about that piece of it all. But I think for me and for a lot of other Indigenous folks, I think it's important for us to actually take that day and like take some time to ourselves and reflect on our shared history. And that was an important piece of it for me on that day in particular. Leading up to the day, like I think there was a lot of work to be done in terms of what are we going to do to prepare people and to shape the frame of mind going into such an important day, and being the first day of truth and reconciliation in this country, like really trying to figure out what that means for us as a society. And so there was a lot of work that we did in our program to put on a speaker series to help inform some of that work. And I think it was pretty well received in the Faculty of Medicine. But the question is always like, when we do these events and when we do this type of teaching, are we really just preaching to the choir, for a lack of a better word, I guess? And I worry about that sometimes, because the people who tend to show up at these events are actually, like, I would say, doing pretty good in terms of their own kind of self-directed learning and whatnot. But actually, like, I was listening to a podcast by Murray Sinclair, who actually chaired the work that was done by the Truth and Reconciliation Commission. And he actually like framed it in a really good way that helped me kind of work through some of that feeling myself. And it's like, we're not actually going to achieve, or is reconciliation something that we're ever going to achieve? Like, or is this more of a lifelong process and journey for our society? And I think he framed it pretty well in thinking like, it's actually like the 7 generations ahead of us that we're thinking about. And if we can change one one mind at a time in this process. Like, I think we can consider that a success. And I try to tell myself that in a lot of the work that I do. So those are my thoughts around last week. I think it's important that we commemorate that day as a holiday, and I hope other provinces will slowly come on board around that. But and I hope people will take that day to stop and kind of reflect on what our role is in Canadian colonialism and the atrocities that have happened in this country.
Yeah. Well, being in New Brunswick, it was uncomfortable for sure to know that, well, I had a full roster of patients booked that day when it was even announced to be a day. And when it wasn't a holiday, it was kind of like, is it in the spirit of Truth and Reconciliation to cancel a whole bunch of kids who've been waiting to see their pediatrician for months and months? And so we decided to take the Friday as sort of a day, and then the learners, of course, were given the day through Dalhousie, which I think was a respectful choice. But what was fascinating for me is that because I did end up seeing patients that day, we had a bunch of just like coloring sheets that we found online that were just like lovely, and they were about kind of just the day. And so just being able to have kids color those in the office on the day and like have that conversation was actually such a fascinating way to bring it to the table, literally. And then because the coloring sheets are still there, I had a family in not too long ago that then all of a sudden that actually became the way the conversation was opened for me to learn that they were actually First Nations, and it was actually quite lovely and opened up a conversation in a way that I didn't have that skill in my office before. Like, I'll ask at times, but it was just interesting that even some of the, like, maybe it's trite, but even some of the materials from the day all of a sudden started opening the conversation. Or the fact that we had some stuff in our office, in our waiting room, commemorating the day, all of a sudden opened the conversation.
Yeah, and I think that's part of the role that this day should play, is that it's providing that space and actually bringing it into the public consciousness, because up until very recently, like, this stuff wasn't known by a wide array of people, and there's still segments of our society that don't recognize it or don't appreciate kind of the extent at which colonialism has affected Indigenous people in Canada. So I think it's the more we can advance that and move that needle forward, I think we'll all be better off for that.
The seminar series was really good, and it was you and two others, because it was the week of September 30th, every evening for a couple hours. And I think they're recorded, and like maybe even listeners could access them, like faculty could access them later. Do you think?
Yeah, so there's actually 6 speakers. We had 2 on the Monday night, 2 on Tuesday night, and then myself on Wednesday night, leading up to that Thursday. And so they're open to the public now. They're recorded and they're on YouTube, and the links can actually be found on our website, which is IHIM. Actually, I don't know the exact link, but we're Indigenous Health and Medicine. Sometimes it's actually hard to find that website. I occasionally try to Google it, and it's like very difficult to find.
Well, I will put it in the show notes, and then anybody listening can just go onto that and click on it and go and check those out, which I'm sure are wonderful. I only got to hear yours, but thank you very much for taking the time, because that would have been a lot of time for you guys to do that, but important stuff. So as you work through the admissions process, I think there were other things that you really wanted to tackle in this role too, which I think is like weaving into teaching Indigenous considerations, but also sort of destigmatizing how Indigenous health has shown up in medical education. Do you have any thoughts on that?
Yeah, I think traditionally, the way that Indigenous health content is covered in medical education is really from like a deficit lens. And so we oftentimes, the only time Indigenous people will show up in a case, for instance, at least when I was in medical school, would be like, oh, here comes like a middle-aged Indigenous patient with diabetes. They smoke, they drink, like very like trying to like perpetuate these stereotypes and stigmas about Indigenous people, which in fact aren't like true. We just know they're not true about all Indigenous folks, and it perpetuates this narrative in the minds of healthcare workers and medical students and residents when they see this content, and so it creates a sort of framework. When you go into a situation with an Indigenous patient, you automatically go to this heuristic and to this bias and stereotype that you have in your mind. And I think it serves to harm Indigenous people, and we know that Indigenous people face a very unsafe environment in a lot of healthcare settings. And looking at like my own practice, I have patients in Sebeganegedy who really a lot of the time, like I'll have to refer to the emergency department because they're experiencing symptoms that are quite dangerous and need to be investigated and treated in an urgent manner. And they flat out refuse to go to the emergency department because they've had such terrible experiences there. And so I think the way that medical education perpetuates this frame of mind among healthcare workers sometimes can be quite dangerous. And I think I would like to change that and flip it on its head in a way, like looking at Indigenous health from a strength-based perspective. Like, how can we actually help empower Indigenous folks, Indigenous communities to better their health through things like self-determination, allowing communities to have governance over their healthcare systems and how that's delivered in their communities. We're not quite there yet, and quite honestly, like I don't know all the answers to a lot of these questions when we're doing this work, and I think that's an important thing for people to acknowledge, because a lot of people expect that there's actually like answers to these very complex questions out there, but the fact is, like, we actually need Indigenous folks and Indigenous physicians and other Indigenous healthcare workers and professionals in the field of healthcare to come on board and do some of this work with us. And we haven't opened those doors quite yet. And so this is why it always, to me, in my mind, like it goes back to education equity and things like the admissions policies and procedures. And people are probably sick of like hearing me harp on the admissions thing all the time, but I think it's like super important because we see the difference that it can make when you bring Indigenous providers into the healthcare system, such as myself. Like, I'm one person and I work 2 days in the faculty of medicine, and like we've already seen like huge transformations. And to think about the things that we could achieve if we actually had a critical mass of Indigenous people in our institutions and in the healthcare system, like that's huge potential for me. And I think there's some change. Like, we're seeing people recognize that more and more, but I'm hoping that we'll see some movement forward over the next several years on that front.
You know, you kind of said healthcare providers and institutions. Is there a spirit of like that interprofessional piece, like also having influence beyond just the medical piece, but into like nursing and other therapeutics and things like that, and pharmacies and places that like collaboratively, interprofessionally, maybe we could even like have a synergy that made an even bigger difference?
Yeah, for sure. Like, I think it goes across the whole healthcare system. Like, we need more Indigenous folks in every role in the healthcare system. And I think that's an important piece of this too, because when we talk about cultural safety and whether or not Indigenous people feel safe when they walk into your clinic, for instance, like there's a whole other team of people that Indigenous people interact with when they come into a clinical environment, I guess. And so if you think that, or you feel that you're doing a great job in cultural safety and anti-racism and all of these things that we learn about, but somebody on your team isn't doing such a great job, like it completely negates all the work that you've done. So it's important that we have like providers that are not only safe, like culturally safe in their practice, but also providers who are Indigenous in these roles. And I think a lot of the different health professions are doing work in this area. And like I said, the more that we can build a critical mass around this, I think we'll all benefit from that.
It must extend to other sort of groups that are underrepresented as well in medicine, right? Like the BIPOC group and, certainly, our LGBTQ2S group, and just being able to extend it into any group that just is underrepresented and therefore like becomes this marginalized sort of stereotyped group in medical education. That again, if it's not the diabetes and the drinking with Indigenous folks, it's like something else with another group. And do you feel like there's partners in this work too, that common ground of understanding we need to create equity amongst all the groups is there? Because there seems to be a lot of other initiatives too that might work towards a common goal of doing better and learning and unlearning.
Yeah, I think like it's certainly thinking about other priority populations and populations that have been marginalized in the past. Like we definitely need to do more work around that. I think the big piece around it is that there's been so much done to oppress and colonize Indigenous people in this country that I think we need to actually, on top of all of that work, like the wider work of equity, diversity, and inclusion, like we actually need to recognize, like we are, like specifically, we need to reconcile the relationship with Indigenous people in this country, and that work is actually quite a bit more specific than some of the wider equity, diversity, and inclusion work that we do, in the sense that like there are treaty relationships and treaty obligations that are not being honored, and we have to honor these obligations, and some of that doesn't necessarily apply to other BIPOC groups or the LGBTQ community, and so I think we really need to understand that the wider umbrella of equity, diversity, and inclusion is one thing, but we also need to understand that there's a very important, unique kind of framework that needs to be applied to Indigenous populations in the framework of reconciliation.
Well, I think that you talked about in your seminar series some ways to bring truth and reconciliation to your day-to-day practice too. What would be kind of some of your top tips for listeners around just when you encounter patients to hold that space and make the safe space for folks?
Yeah, I think the biggest thing that you can do as a practitioner in your day-to-day practice is to actually recognize the role that trauma has played in Indigenous communities for so long, and so recognizing that potentially almost every interaction that you're having with a patient, there is a history of trauma that goes back to their previous interactions with the healthcare system. And like a lot of Indigenous people, like most Indigenous people that I meet, and myself included, have had very violent interactions with the healthcare system. So when Indigenous people come into a clinical environment or come into your clinic and are talking to you, like they might have this idea like this is going to be a dangerous situation for me, or this is going to be a violent situation for me. And ways that you can actually make that a safer space for folks is actually like asking for permission to do things. Like it's like such a basic concept that I think we forget about in medicine. Like we're in a rush in our clinical environments, especially in family medicine, because our appointment times are so short, and we have an agenda, and we need to like find out this information and kind of come up with a differential diagnosis and investigation plan and treatment plan outside of that. And we forget to ask when we're doing things like physical exam, like, is it okay if I listen to your heart and your lungs? Is it okay if I examine your belly right now? Like all these very basic things like actually go a long way in making a space a lot more comfortable and safe for folks, especially folks who've experienced trauma in their life. So I think there's that piece of it, but also examining yourself and reflecting on your own practice and your daily practice. So we actually have a resident who's coming through our clinic now, and a big thing that I want to work on with that resident is like reflecting at the end of each day, like how did the day go? Like how could that interaction have been perceived by that patient? Like was I uncomfortable during any of these interactions? Could the patient have felt the same way? Like why was that uncomfortable? And thinking about ways that you can actually make that better next time for yourself and for patients. And I don't think we do like a very good job. Like sometimes we'll get in a rush, and I've seen a lot of physicians actually being in a rush, and a patient is like, and I actually mentioned this during the speaker series, but like a patient is walking down the hall, and the first thing they say to them is like, "You're late." It's like, why are you telling this person that they're late? Like I think they probably know that they're late, and it just, when the patient has had like a traumatic interaction with the healthcare system, or any patient for that matter, like that is like a very like triggering thing to say to somebody. It's not setting the interaction off on good footing. So like, if you're still going to see that patient anyways, like why even bother? Like why bother telling them they're late? Or like at least use it as an opportunity to inquire about like what's going on in their life that maybe caused them to be late. Like maybe they have a ton of things going on with their kids, like and they're dropping somebody off here and all that kind of stuff. Like we forget about that because we're so like focused and in such a rush sometimes that we forget about like common courtesies, like being nice to people is
yeah, or just recognizing the compassion of somebody else's life. Like, I don't know about you, but I'm late sometimes, and it does have to do with like reasons that maybe you don't even want to explain.
Yeah.
But at the same time, you're right. Well, especially if it has any like direction of social medicine, you're just happy that they did come. Like, I don't care when you come. This just means I don't have to go track you down now. So that's great that you're here.
Yeah.
Oh my gosh. Okay. Well, those are some wonderful tips. I know that, I mean, I love it for us as a faculty. Like, I just think about, we have sessions on like difficult conversations or like conflict or how to ask difficult questions and stuff. And like in peds, we do a lot of training on like talking to youth or asking about drugs or alcohol or sex or, gender identification and things like this. And I think we're getting a lot better at those things. But I've had a learner recently too, who just, when a First Nations family came in and she knew that they were First Nations, but she just didn't have the words to talk to them about the issues that would be like most pertaining to their health. Like, how do you pay for your medications? Like, and what's relevant to the conversation and what's not relevant to the conversation, being wary about triggering people. My friend Chris Locke, who works in BC, always says, like, you don't have to ask every question on the first date. Like, you don't need to know all the stuff and things. You can build that rapport and that trust and that relationship before you necessarily check the boxes. And what boxes do need to be checked for you to provide safe and adequate care for people. So I love that, the thought of doing faculty development, but also education for our students about just how to ask questions in a place that's safe and trauma-informed, I guess would be the terminology. I had the privilege of interviewing Patty Bedwell Doyle in this podcast a couple of podcasts ago. So shout out to Patty's podcast. If you guys want to listen to that, it was amazing. A bit, just deeper into, they were just making some of the early announcements of residential school grave findings or burial findings. And so it was very hard conversation. But I think Patty and I also wanted to talk about sort of the sense of what we can do as faculty and as allies to acknowledge the land and to bring that into our day-to-day. And so I asked you if you would go on that journey with me in this podcast, because Patty and I didn't get to it. And some of the listeners were like, I waited the whole podcast to hear you talk about land acknowledgements and you never did it. So Brent, will you help walk me through land acknowledgements? Because I know that we all think it's important, and I know that we all worry that it'll drift to a tokenizing sort of just thing that we do. But I, for one, want to do it right and want to acknowledge it the way it should be acknowledged.
Yeah, so this is like a very common question that I've been encountering in recent days. And I think like the biggest thing is always like asking yourself why. Like, why do I want to do a land acknowledgement, and why is that important to me? And that's a good starting point. And then like actually learning about the land and the territory where you're situated. So like trying to read like online, asking folks around you like what they know about the land, and learning like traditional names for the land, like Mi'kmaq names here in Mi'kma'ki, is an important starting point. And then I think from there, actually like recognizing that a land acknowledgement is like but one small piece in the whole puzzle of reconciliation. So it's obviously like it's not going to solve all of these complex issues we have in our society, but recognizing like it's a small act of reconciliation. So it's a way to acknowledge the rights and the histories of Indigenous people on the lands where you live, work, and play. And in some ways, like I've actually gone through an interesting relationship with land acknowledgements in my mind, because I think I've often seen it become like a rote exercise where people just like, oh, this is like the standard land acknowledgement for Dalhousie University. I just need to like plug this into every presentation that I do and go on with my day. And I think like I struggle with that. Like I would much rather a land acknowledgement come from like an authentic and meaningful place. So doing a bit of that work and like learning about that history is a big important piece of that. And I think another piece, like people are actually so scared to like make a mistake or like do something wrong, and like recognizing that generally like Indigenous people aren't going to get mad at you for making a mistake or pronouncing like the name of a place wrong. Like that's small.
Oh my gosh,
like,
that's always the way, right? Because for us, it's the Wolastoqiyik, and it's just like you can hear people sort of limp into the pronunciation, and even if you put the phonetics beside it. But yeah, I guess kind of just being vulnerable, willingly vulnerable to make a mistake.
Yeah, and that like honestly, like I wasn't fortunate enough to be like raised to learn Indigenous language, and so I make mistakes in pronouncing these things like all the time, like constantly. And like when I get a chance, I ask my friends like, "Oh, how do you pronounce this?" Like, I mean, if you're comfortable enough with somebody, it's like you should be okay to ask them that. But on the flip side, we're not here to answer every single question that white people have.
Well, that's it, right? So that's why it's such a privilege to have you on today. So I truly recognize that I'm peppering you with the difficult questions that we all sit and kind of grapple with. So thank you very much.
Yeah, it helps that I get paid to do this work.
Yeah, do they pay you enough is the question, I guess.
It's a conversation for another day.
I just had this vision of whether or not your Indigenous language is one that, like, if it's the matter of just small syllables, like you could completely change what you were trying to say, and that it like actually gets it gets weird if you said something totally different. So I just know how hard it is sometimes to learn new languages. Did you learn it right from a young age? Like it was offered to you?
No, like I said, I didn't have the opportunity to learn like my.
Oh, I thought you said you did.
No,
Okay.
no. So like I had the.
Would you like to learn it? Can you learn it now? Like, is there anybody around that could teach it?
Well, because I'm so far away from like our home territory in Manitoba, it'd be very, I think, difficult. I have some people on Facebook that I like try and learn some things off of and whatnot. But I would be interested in learning more, particularly Mi'kmaq, because like I'm in Mi'kmaq, and it'd be nice to be able to chat with my patients a little bit and actually. Some of my patients are elders and they do a lot of this work and like teaching language and whatnot. And that's like an automatic, like it's such a great like way for us to like build that rapport and relationship, because they're so happy to teach people about the language and whatnot. And the other day, like she brought in her t-shirt and it had like Mi'kmaq language on it. And like she was trying to teach me how to like say every child matters. I still can't say it to this day, but like I love it. And I wish I had more of that in my life, to be honest. I wish I had those skills, and it's something I'll work on. I was actually hoping to take a course at Dal, but I'm too busy with all of this work to take it.
There's a time and place for everything in this life, and the universe does what it's supposed to, I suppose. It's interesting though, because I was just sort of brainstorming in my mind what faculty could do to, again, be allies and friends to your efforts and the efforts of bringing Indigenous health at the forefront for Dalhousie. And it's just, sometimes I feel like there's just little things, like you walk into the hospital and things, just on the topic of language, in New Brunswick, there's posters all over the place that just say, we're happy to serve you in your language of choice. But what they mean is French and English, and you just sort of think how much broader our communities have become and how much more like, the list of languages goes on in Arabic, and, we have a large Chinese population in St. John at least. And so I just sort of think like, what are we doing to really meet that patient-centered care that we know that we want to do? And so I love that we talked today about some like tips right in the office, but then also that kind of broader meso and macro approach that you're doing, which is your good work. What can we do to help you? How can we be better, Brent? I'm sorry to put you on the spot. Thank you for being here.
No, I think the biggest thing is that we've not reached that critical mass that I keep referring to of resources, and that includes like human resources, financial resources to do a lot of this work. And so I've actually, like, I say it almost at every meeting that I have with anybody in leadership, like, please, if this work is important to you, as it seems to be, because there's a huge amount of demand and my schedule can be like filled up like weeks and weeks in advance with just like meetings to meet folks and like talk about what their needs and priorities that they see for their particular organizations or departments or divisions and whatnot. But like, please, like, just spread the word. Like, this, we need to actually have a systematic way that we are funding and providing resources to people doing this work. Not only myself, like, this includes other programs across the university, because there's so few of us. Like, a lot of this work automatically like defaults to us to like, okay, so Brent is here, like, let's get some of this work done, like, email Brent, let's meet Brent and figure it out. And sometimes it's just like, literally, I don't have the hours in the day to do all of it. But if I had more folks to help me out, like, that would be helpful. And thinking about the way that funding is, like, not even only just in the university, but like across our society and with various Indigenous organizations, like the way that funding streams work, like, it is so fragmented in the way that it's delivered. And so everything will become like very project based. So you'll go to one First Nations community versus the other, and you'll see like there is one public health program happening in Sebago-Negudi, and it's completely different from the public health programming that's happening in Eskazoni. And it's just a nature of the way that we've oppressed Indigenous people in this society, and have not given Indigenous people self-determination over healthcare systems, or any systems for that matter, to have like an overarching organized approach to addressing some of these issues. So like, I mean, that's my big wish list. Like, I think we can probably do a better job at stimulating the systematic change that we need to see across society, but also like in the university and the Faculty of Medicine as well.
Well, I'm guessing that there's lots of opportunity, even like your seminar series alone, as an opportunity for us to educate ourselves and learn more, and then bring that compassion and patient-centered and equitable approach to our practices every day, but also how we teach and how we model that for our students, and holding space for all of our patients in our office. And so I think it's amazing to have this conversation with you and to know how energetic and passionate you are, and how lucky we are to have you. I worry about you being right out of your residency, but I think that means that I'm old and I'm just like, oh gosh, so much energy. Pace yourself. Be kind to yourself. Ask for help. We're here to help you. And I think I speak for all of the faculty when I say, like, long overdue, and we're so happy you're here, and what a pleasure to talk to you today.
Yeah, no, I'm very happy to be here, and it's been extremely welcoming. Like, in the Faculty of Medicine, I'm happy to meet new folks and see a lot of the great work that's being done across the faculty, and I'm happy to help with it, because like you said, I'm very, like, extremely passionate, if you can't tell.
And while I'm disappointed in New Brunswick's recent behavior, it's not all bad, and so please come and visit us in New Brunswick and bring your passion and energy across the border, and we'll welcome you.
Absolutely. And like I said, I'm here to serve all the three maritime provinces, New Brunswick and PEI included. I need to do a little bit more outreach into PEI. So if anybody's listening, please feel free to reach out to me.
Yeah, no, there's some wonderful groups in PEI. You'd be lucky to go over there. I think you need a COVID swab to go over there right now, though. So I don't know. They don't want any New Brunswickers over there right now, I think, but you might get away with it. Dating up my podcast. Here we are in the middle of another little fourth wave. So
yeah.
So Brent, thank you so much. And thank you for the work that you do. And thank you for just being part of our community. And I'll look forward to having you up here in New Brunswick and continuing to watch the good work you're doing and hopefully be a partner in that.
Excellent. Yeah. Thanks for having me. It's been awesome.
Thanks. Bye-bye.
See ya.
Thank you for listening to the Fact Dev Lounge podcast. Please leave us a review on iTunes, YouTube, or SoundCloud, and even a comment on some ideas for future podcasts. Thank you very much and have a great day.